Good day, mates. Today on the Prowl, we will be venturing into the far corners of the PA department in search of some very strange and interesting species. Let's see if I can turn this thing on. Oh, there we go. Oh, just in time. Okay, here we are. Here we have the Rebecca S. roteus in her natural habitat. Let's just take a minute to observe her in her natural habitat doing what she does best. Oh, it seems as if she is a typing fiend, and the email is titled "Read the Entire Thing." Oh dear. She just keeps going and going and going. This must be some sort of defense mechanism. Let's take a look at her in action.
Class? All right, now it's time to get started. I know it's 3 o'clock. I know you're tired. You had a full day of Miss Haddo, Dr. Elam. I know you're tired. We have a lot to do today, so I want everybody to look up here right now. Cody, you got my Red Bull? That's it? That's the biggest you could find? Sit down. I'm just kidding. This is good. Thank you so much, Cody. Thank you so much. I'm going to need this, guys. Y'all got your coffee. If you're tired, stand up. Stand up. Okay, so today what we're going to do today, we have a lot to cover. I know you're tired, but just bear with me. We're going to get through it. We'll do everything that we need to do to get you to understand, but we're going to do an entire EKG from start to finish today. I'm going to teach you how to analyze a 12 lead, do group lead analysis. We're going to do left to right shunts. We're going to do right to left shunts, and then we are also going to do all the valvular diseases in 30 minutes. But before we get started, I'm going to come over here, make sure we're all checked up in here. Okay. Did y'all get my email? It was titled, "Please read the entire email." Should have read that. I just want to make sure that we're all aware of the scheduling changes. The lab schedule that you got in the attached email is the schedule that for your labs for the next 12 years of your life. So do not delete that email. Y'all need to make sure that you read everything on that email because we're not going to tell you when and where you need to be. Okay? So now we're going to get started. Everybody up here, please. All right? Good. Thank you so much. Okay. So let me just get this taken care of right here. I need to change the color, but it's too hard. Okay, so let me get up here. Do y'all see what we're doing here? Let me just make sure. Y'all see my arrows? Okay, so when you look for a STEMI, you are going to look for in leads 1, 2, 3, AVR, AVL, AVF, V1, V2, V3, V4, all the way through V86. And if your ST segments are continuously elevated in all of those leads, it's a STEMI until proven otherwise. Does that make sense? Does that make sense? Okay, great.
Now let's venture further into the world of the PA department in search of the Judithius stolis, one of the most rare creatures to be found on this side of the world. I'm so excited for this.
Okay, ladies and gentlemen, we're going to learn about the speculum exam. And so what you want to do first is you want to make sure that you have everything set up before you go into the room with your patient. And so what you'll do is you'll have your speculum that you will use. You will also have your cervical brush. And you will also have the lubricating jelly to apply to your speculum before you insert it into the vagina. Now, you don't want to ever use water, okay? That's horrible. You want to make sure that you use the lubricating jelly, the KY jelly. Now, and of course, usually, sometimes now they come in these small little packets, which are great. You just, use the whole thing. But if you do go into an office setting in which you'll need to have, the one big tube of the lube, what you would do is you would hold it from here and you would slowly let it drip onto the speculum. Okay, so you want to make sure that it's nice and lubricated for the patient. All right, so what you do when you go into the exam, you have your patient. And ma'am, are you doing okay?
Uh-huh.
Okay, great. You just want to make sure that the patient's comfortable because we've all been in that situation. I mean, bimanual exam, you just make sure that the drape is back over the patient. Okay, ma'am, now we're getting ready to do the bimanual exam. You okay?
How did everything look in there?
Oh, look what I found. It's Lisa is Dyches in her natural habitat.
Good morning, class. My name is Lisa Deitch, and I am the baddest admissions coordinator in the state of Georgia for all of the PA programs. Today, you all will experience the first day of the hardest 2 years of your life. In fact, there is a 92% fail rate if you do not study, read every book entirely, study, memorize the objectives, and listen to all echoes. And we cannot have any of you failing these courses. So you will have to study like you've never studied in your life. Okay, so for beginners, who has not downloaded ExamSoft? Today, you will all take your medical terminology test. This is a very, very hard exam, so prepare yourselves. Okay, so has anyone not downloaded the test on ExamSoft? And Bradley?
I let it go the first day, but I just need to, it's B-Rad, it's European.
Well, what are you waiting for?
Oh, you're talking about downloading it. I don't know, I just didn't do it.
Oh, goody, I've been waiting for this all afternoon. The Alicia is enormous in her natural habitat.
Hey, Dr. Elam.
Hold on. Yes.
Okay, so the class voted, and they're wanting to change our test for next week to next Friday instead of on next Monday.
Let me get this straight. So you want me to change my exam to next Friday?
Mm-hmm.
I have a dance competition. I'll think about it.
We interrupt you in your evening episode of On the Prowl to report a very interesting report. As always, Channel 13 WSB-TV-K 36 Channel 867 is first on the scene to give you the minute-to-minute news. Stay tuned for Monica Kaufman.
Coming to you live from Channel 13 WSB-TV-K 36 Channel 867 News. My name is Monica Kaufman, and there is breaking news at MCG or GHSU or GRU or AU, whatever they call it these days. Live to you. Thank you, Monica. I'm now live in the PA department where this student has apparently become distressed over this cardiology exam.
It appears this student is in severe respiratory distress after learning that she has a cardiology exam on Friday. Oh, what's that? What's that, Jeff? This just in. They think that she's having a heart attack. For all of you viewers out there, please make sure you take the time to know the signs and symptoms of a heart attack. You can have chest pain, shortness of breath, clammy skin, anxiety, nausea, vomiting, and women may present differently. Also, know your risk factors for heart attacks, which include smoking, high blood pressure, high cholesterol, strong family history, stress, illegal drug use, obesity, older age, and lack of physical activity. Now back to On the Prowl. Well, mates, that's all I have time for today. Join me next week as we venture out into the great unknown in search of lions and tigers and bears. Oh my. Amber Irwin signing off. See you next time. And don't forget to always stay on the prowl.
Good morning, class. My name is Lisa Deitch, and I am the program PA. Wait till I finish my other. Are we ready?
Mm-hmm.
Class, we're going to get started in 2 minutes. Okay, that's enough. We have a lot to do. So everybody take your seats up here, please, up here. Today we're going to start with doing reading. Yes. That's what I'm talking about, Cody. Bring that bad boy on over here. There you go.
Oh, look.
Yes. All right.
Oh.
Now we're talking. We got the lube.
Yeah.
Thank you, Monica. Okay, I'm right here on Augusta University campus with my friend Cody here. His leg day, buddy,
Talk to me.
just fell out on the floor over anxiety.
Do you need
for this
something?
course.
Is he okay? Is he
You
okay?
go get the AED. You call 911.
It's an emergency.
Sure. Would you mind giving some rescue breaths for me?
Yes, good thing I learned this from Miss Red last weekend. Hold this.
Look what I found.
Ooh, hey, all right. Charger up.
Clear?
Clear, everybody clear. Shocking